So this is the ventilator. So this ventilator help the patient whenever the patient has the breathing difficulty or respiratory failure. So we'll talk about the respiratory failure. So there is the 4 types of respiratory failure. Mainly we'll talk about the first and second type of. First type of respiratory failure is the type 1. That is the patient mainly will have the hypoxia. Then we'll have the type 2 respiratory failure. In this the patient mainly will have the hypercarbia. So in hypercarbia, which type of ventilator will require, we'll talk about that today. So in hypoxia, mainly patients most of the time require the invasive ventilation that we do with the intubation, and we ventilate the patient with the invasive mode. So and then type 2 respiratory failure, patient will have the hypercarbia, patient will be unresponsive, drowsy. In that case situation, we use the NIV, non-invasive ventilation, to come down on the CO2. So we'll talk about the non-invasive ventilation. So how we set the NIV or non-invasive ventilation? We provide this mask. This is the NIV mask. This put on the cover the nose and mouth, and this is the braces. Through this we cover the patient's nose and mouth, and we set the NIV, non-invasive ventilator. So NIV, how we set is the, here the setting will have the pressure support, PEEP, Tmax, and the FiO2. FiO2 we start with the 100%, then slowly come down on keeping the SpO2 around 90 to 92%. Then we keep the pressure support. Pressure support we keep depends on the patient's lung compliance, how much pressure support patients we require. So we required our minute ventilation. If with the pressure support of 8, this patient is generating around 400 tidal volume, so our minute ventilation here is the 8 liter. So this is the okay with us, this pressure support. So this patient has the good lung and he is generating good tidal volume. If patient has bad lung or bad compliance, we require to increase this pressure support to getting the same minute ventilation. Thank you.